My name is Derek Redd. I'm the managing editor of the Intelligencer and Wheeling News Register. I work with John McCabe up there in Ohio County, and I will be overseeing the panel here on healthcare. Healthcare is a subject that transcends age. It transcends socioeconomic status. It is a subject that is important to every person in West Virginia and will be an important topic and an important subject in this year's state legislature. So without further ado, let's get to the panel here. I'll introduce you all. Starting here is Dr. James Nemitz, president of the West Virginia School for Osteopathic Medicine. Next up is Ms. Elizabeth Pellegrin, the vice president and chief marketing officer of Vandalia Health. And retired rear admiral Dr. Stephen Pachuta, who's the dean of the School of Dentistry at West Virginia University. I'd like to have you guys give a little bit of an introduction and also start you off with the first question. What do you need the legislature to do this session to make healthcare more accessible and make the healthcare business more successful? Dr. Nemitz, we'll start with you.
Well, certainly, I guess this is on. So my perspective is in the area of education and medical education. So, because healthcare is complex. There's a lot of needs. I mean, one of the things right up front is and I'm physician oriented, and I realize that there's multifaceted components of our healthcare system, and they're all important. But in terms of physicians, one of the things is to look at the possibility of incentives for those physicians who do stay in our state to practice, especially new physicians that stay. There are disincentives to practicing medicine in the state, and the reality is that they can. I had a recent grad of mine say, I could go down to Florida, and I could get paid a lot more money, not have to pay state income tax, and benefit my family more. So what keeps him here is his family's here. He loves this state, and he's here to serve. And so my point is that we need to hold on to those people. We need to hold on to as many of our physicians and our providers as we can. We need to look at innovative ways to do that. The other piece, of course, is higher education in general and supporting higher ed so that we can be the economic engines that we are. I mean, each of us are an economic engine for our community. In the case of WVSOM, in addition to Lewisburg, we're in all the major population areas throughout the state. And so we have an economic impact throughout the state. We want to be able to continue to grow our programs, and in order to grow, state support is important. So those are two areas that I think would really help the healthcare area.
Okay, Ms. Pellegrin.
Thank you for the opportunity to be here. I would like to second what Dr. Nemitz said, because we are an academic medical center and we support both WVU Medicine and the School of Osteopathic Medicine with residents and students there. And so the importance of academic medicine and supporting physicians to train and stay in the state is absolutely critical to have a pipeline for those folks who are going to take care of us in the years to come, including myself, God willing. Other opportunities, the very important priorities this year would be improving the financial stability of hospitals. West Virginia is unique in some ways in that we are, of course, a very poor state. We rely heavily on government-funded programs like Medicare and Medicaid, and so it's critically important that we maximize those dollars that are coming down or could come down from the feds, in this case, particularly the Medicaid match. And so that's a critical piece to what we need to do this session. And also supporting our healthcare workforce. It is a very challenging environment. I will speak on the CMC part of Vandalia. We have General Hospital, which is of course a very significant tertiary care center, trauma center. And we had to institute a few years ago a little emergency badge that's worn with your regular badge that you can press it, and so through GPS we know where all of our employees are, because we had so many attacks on our employees by both patients and family members, largely due to the drug situation unfortunately. So protecting our healthcare workforce and security in this specific legislation around the anti-doxing legislation, because we have, with social media, as you all know, people can be unhappy about something and say, I'm going to find out who my nurse is, Elizabeth Pellegrin, where she lives, and I'm going to post that online. So we have to protect our healthcare workers.
Okay.
So thank you very much, sir. With your question of, what do we need to make healthcare more accessible? If I could take just a couple minutes and give you a quick overview of the school, I think that may tee us up to give us a response for this question. So, and I have a couple of slides, if that's okay. Just to kind of let you know who we are and what we do. I think that's important. So just a little bit about the School of Dentistry and who we are and what our priorities are. The school was built in 1957, and we graduated our first class in 1961. We have a DDS program, which we refer to as our pre-doctoral program. We have a dental hygiene program, but we also have advanced education programs. We have advanced education programs in oral and maxillofacial surgery, orthodontics. We have general practice residency, endodontics, periodontics, prosthodontics, and probably one of the biggest wins, if you will, for our school this year is we're going to start a pediatric dentistry residency program in July. We're going to take our first 3 residents in July. This is important because as we talk about gaps in access to care and social determinants of health, where do those challenges lie? Slide, please. We being the only dental school in the state, what's our vision, right? As a school, what are we doing and why are we doing it? We really want to be the school of choice for students, faculty, staff, and patients nationally. We're part of an academic medical center, an academic healthcare center, if you will. We're one of 5 schools. Most dental schools around the nation today are standalone dental schools. We want to be able to come together and leverage the relationships that come from being in a large healthcare system in an academic healthcare setting. We need to maintain our approach on comprehensive healthcare. We need to be flexible for the future demands of dentistry. Dentistry, the profession of dentistry, is going digital and digital technology incredibly fast. The way that we practiced 5 years ago, and in some cases even 3 years ago, is not the way we're practicing today, and it's not going to be the way we're practicing in the future. We also think there's a lot of advantage to bringing our residency programs, which are at kind of an off-site, back into our pre-doctoral programs. So what's our focus of effort for the next year and for the coming years? We have an accreditation site visit. All schools go through these generally every 6 or 7 years. We have one of those this year. I mentioned the pediatric residency program. That's an important part of the future of the school. Faculty and staff recruitment. That is a big challenge nationally. I know my medical colleagues face many of the same challenges, but getting faculty and staff to come into to academic dentistry, as I like to refer to it, is very challenging. From 2011, 2012 to 2023, over that 10-year period, we went from about 200 vacant positions nationally for dental educators to well over 500 today. So that's important. Student recruitment. We have somewhere between 700 and 1,000 applicants every year for our programs. We have to be competitive. We have to stay competitive with our 72 other dental schools in the country for recruitment and retention. And to do that, we need to modernize our curriculum. We need to have that focus on digital dentistry and digital technology. And we also need to renovate our facilities. I'll talk just a little bit about that. I'm almost done here, honestly. Couple of data points that I think are real important. 83% of the dentists that practice in this state are graduates of our school. 83%, large number. 41% of the graduating class of 2023 elected to stay in West Virginia practice. That's up over 22% from the year before. Our rural rotation, our rural engagement is part of our land grant mission. We send students out into the community, our senior students, and they work at private practices around the state. Well over 10,000 procedures that they perform during any academic year. So, and our School of Dentistry serves as I like to term it, the community care center for access to care. The Medicaid benefit, the adult Medicaid benefit, $1,000 for restorative care, was a game changer for access to care in our state. Lastly, one more slide, please. I talked a little bit about renovating and modernizing our facilities. We have a renovation plan and a renovation initiative right now that is the first real comprehensive modernization of our school since it opened in 1957. We've got about 52,000 square feet of floor space that's programmed for renovations. It's about a $35 million project. We continue to work this. We've got funding opportunities across a number of different areas that we are drawing upon to successfully launch, if you will, our renovation initiative. One more slide. As you can see, our current spaces are nearly doubled with this renovation project. Last slide, please. So, you know, I like to refer to it as a strategic imperative. You know, you talk about how do you increase, how do you set the school up to set the state up for access to health care. Again, you know, if you look at the social determinants of health, and this is going back to your question right now, you know, what do we need to help make access more available? I think, you know, the adult Medicaid benefit was a really big game changer for our West Virginia families. It was mentioned earlier today that so many of our families, and they've taken it back generations, don't have that access to health care because of the gaps in access to health care that we need. Social determinants of health, again, drive where you're born, where you grow up, where you live, determines the amount and level and access that you have to health care.
Next question I have, Speaker Hanshaw had mentioned earlier today in his comments that the legislature may be interested in investment of physical infrastructure for healthcare in West Virginia. From your guys' perspective, where do you see those investments most needed in West Virginia? Ms.
Well, I
Pellegrin?
can start by saying that I think a very exciting development, maybe one of the few that came out of COVID, was the vast and quick growth of telemedicine. And so I think investing in telemedicine centers, investing in mobile medical units. I know with Vandalia Health, which includes CAMC, Mon, and Davis Health now, all those health systems coming together, we have several mobile medical units are investing in more to expand on, you know, available for CT technology to be in communities, as well as mammography. But telemedicine has been, you know, CAMC specifically and Mon before COVID invested in telemedicine infrastructure, and we're slowly starting to build that with COVID. It just took off. And what we're seeing is we have facilities doing cardiology, telecardiology, telestroke. These are often hospitals working even with hospitals. So we have physicians and EDs in smaller hospitals who are calling into a stroke center at General to a stroke expert saying, how do I handle this case? So there's some somewhat minimal infrastructure investments that could really gain a lot of access, back to your access question, easy for me to say, in these rural communities. And then also there are some small hospitals, some critical access hospitals that really need some infrastructure funding.
Amber, what do you think?
I think she nailed it with access and technology. Infrastructure for technology. You know, I think we talk about telemedicine, teledentistry, telehealth. We've used it in the military for years, from sea to shore and combat fields and back and forth. But to set up that actual infrastructure is really challenging. It takes technology, it takes software technology, it takes hardware technology, and it takes facilities infrastructure in order to execute that. So,
yeah, and that's what I would say for higher ed as well. In general, I mean, the need for continuing to put dollars into the infrastructure is important. We've had very flat budgets for quite a few years, and so there are only so many places that we can go to support our schools and our students, and so one of the things that's happening is increasing tuition. At WVSOM, we've worked very hard to hold the line on tuition, and in fact, we have the lowest tuition in the state for both in-state and out-of-state students. But there's a need to continue to invest in that infrastructure. And I'll give you an example. I mean, it goes back not only to the facilities like the hospitals, but also how you train your students. One of the things that we've gotten into is simulation. In fact, if you're ever in Lewisburg, we'd love to show you our simulation center, which is one of the largest, certainly the largest in the state in terms of higher ed, but one of the largest in the country. So one of the things we've gotten into is virtual reality. And you can create any type of medical scenario you can think of, and then create a program that then students could use virtually anywhere, and then be able to use that to train people to go over scenarios that they're going to face in real life. It's a very powerful technology. It costs a lot of money. And so that's the challenge, is finding the dollars. And certainly we're looking at grant dollars as well, but getting those dollars to be able to provide our students with the best technology, the best education that they can have. The other thing that I would say in terms of access is, if you want to, specifically if you want to grow physicians in this state, what you want to do is you want to invest dollars into residency programs. And we need to build up residency programs. If you want more physicians in this state, that's what you want to do, because the studies show that if you could take a person from the state who then goes to medical school in the state and then goes to residency in the state, guess what? There's a very high probability they're going to stay in the state. It's like 80%. They're less likely to leave. And so investing in that next piece, because everybody thinks, well, it's just, the college and the med school. It's more than that. To be a physician, you're looking at 4 years of undergraduate, 4 years of medical school, and then anywhere from 3 to 7 years of residency. And so a lot of our med students leave the state because of either they don't have the residency that they're looking for, or there aren't enough positions. And so, all of the major hospital systems, this is an important pipeline for them. And so I think investment in residencies, now I want to do a shout out to both, to CAMC Vandalia, that's growing their residencies. Marshall Health Network is growing their residency. They established the first rural surgical residency in the country at Logan. And then WVU Medicine, in terms of growing their residencies. It's important work. WVSOM also has a cadre of small family medicine residencies. So this is an important piece that I don't think a lot of people understand. And if you want to grow physicians, grow residencies.
And just to foot stomp what Jim said is, our pediatric dentistry residency program, the intent will be, to take 3 residents every year and then retain them for that access to pediatric populations, but also special healthcare needs. And again, the technology is a real force multiplier today. Most folks in this room have probably been to the dentist where they actually take a scan, send that digital image to a machine in the next room, have it subtractively manufacture or mill out a crown, and then an hour later you got it in. Whereas 5 years ago, it would go in the mail, they would use the impression material, you might get it back, it might fit, it might not fit. That is a force multiplier using technology and digital computer-aided design and computer-aided manufacturing.
If I may add very
Sure.
quickly, could not agree with the gentleman more at all. And virtual reality, it's fascinating. We just opened a new Center for Learning Research in Canal City, CAMC did, and state-of-the-art simulation centers, labs. They have mannequins that give birth, that go through surgery. In real time in the control center, they can create complications. It's really incredible. But when I saw the students using virtual reality and I had a chance to try it, I'm 56 years old and I was terrible. But these folks who've grown up gaming and all that, they're looking for that technology. They can train very quickly and very well and repetitively, which then will lead to decreased complications, and actually practicing medicine later. And the best and brightest are looking for that. That's what they want to train on. So if we don't have those technologies to offer in our medical training facilities, the best and brightest aren't going to come here or stay here.
Yep, they're going to go other places.
Now, you guys have mentioned things like rural surgery residency, rural dentistry rotations. Now, rural health care is seen in some states as especially, but Dr. Nemitz, I think as you and I have talked to before, in a state like West Virginia, all health care can really be classified as rural health care. So what do you guys feel, and this we'll throw this out to everybody, what do you guys feel are the needs you see must be addressed immediately to help fortify rural health care in the state of West Virginia?
Well, WVSOM's approach is we've embraced the rural, our rural mission. I mean, our school was created to address the needs of rural West Virginia. Most of the state is rural. And the way we've been doing that is we've built an infrastructure throughout the state that we call our statewide campus. So the reality is, while a lot of people think of WVSOM as, it's that school, the O School in Lewisburg. The reality is WVSOM is in Parkersburg, Morgantown, Clarksburg, Princeton, Bluefield, Martinsburg, Huntington, Charleston, of course, and Wheeling. We're everywhere. And that's because of our statewide campus. And this model, I think, is a very effective model because take a look at the latest report, the latest health professions and rural health report that's in the Higher Education Policy Commission. It was just at their last meeting in December. We put WVSOM put 81 new physicians in rural areas. That's a remarkable number. That's a remarkable number of new physicians in rural areas. I'm convinced it's that statewide campus where you train them in rural areas. They're exposed to rural practitioners. They learn how to practice medicine in a rural area, and you give them all the tools that they need. It's a very powerful system of education. And it's different from what other people are doing. So the point is to take innovative ideas to address the needs of the rurality of the state, and that's what we've done. We work with all the hospital systems in the state. We work with clinics throughout the state. And again, the other thing I would say to people is the more you work together, the better it is for the state. The more you collaborating with Vandalia, collaborating with WVU Medicine, collaborating with Marshall Health Network, and then the other rural hospitals, the Logans, the GVM, the other smaller hospitals throughout the state. It's essential in terms of helping this state, helping our people become healthier, because really the goal is to get people healthier here. We so desperately need that. And it's related to access. And so those rural, it's important to have those major hospital systems throughout the state. But one of the big problems West Virginians have is transportation issues. I mean, I just came from Lewisburg, it's almost 2 hours. We have a lot of people who get their medical care in Charleston from Lewisburg. But for your day-to-day care, you need somebody nearby. And that's where WVSOM has filled a niche in terms of providing physicians in their town, in their county. We're in 52 of 55 counties. We want to be in all 55. And that's part of the access is how far away is the person from a medical facility. And so if you want to improve outcomes, we got to support these rural facilities. And we got to support the people that are working in them.
Collaboration is really key. Vandalia works crossways with Marshall Health, with WVU Medicine, with the schools to work on rural medicine. And part of that access piece is getting it in the community. And so a couple of things that we do through Vandalia Health Network, which is a clinically integrated network, is we're working with, it's not just about sick care and hospitals, and we work with skilled nursing facilities and it's the whole continuum of care. How can we decrease costs, increase access, and improve outcomes? But it's also how can we work in preventive health? And so we're doing things like working on the socioeconomic factors of healthcare. How can we help people get to their appointments? Not only can we create a telemedicine center nearby or a care center nearby working with rural medicine providers, but how do we get people to those appointments? How do we offer vouchers? How do we provide the actual transportation? We're also looking at food deserts, and so we've been working with Dollar General and other stores that often are the only stores within those communities to have them put in freezers and refrigerators to provide fresh food, and then we're offering those coupons. And so it really is that full continuum of care, and the collaboration all along the way is the only way, especially a state like West Virginia that has its own challenges, unique challenges, is going to get where they need to go.
Yeah, we struggle with that in the dental profession as well. I mean, if you're in Morgantown or Charleston or Huntington or Beckley or Wheeling or Martinsburg, you got pretty good access to care, right? I mean, there's a fair number. We have counties in this state that don't have a dentist. Folks have to drive an hour or two for dental care. And so what does it take to get someone to go to a county that may only have one dentist or no dentist versus a Charleston or a Beckley or a Huntington? And it's that networking, it's that partnering with other healthcare facilities in the area. It's a comprehensive continuity of care that we struggle to get. All right, so many people will come in for a sore throat, and in the healthcare side, I mean, most folks know that the ED is used as a primary care facility in so many places. That is the single most expensive delivery of primary care in our country. In dentistry, they will come in for a tooth to take the tooth out, and then they never come back till something else hurts. And that's that comprehensive continuity of care. So how do we get providers to go to areas that are less, dense and less populated? And I'm gonna throw in the cost of education and the student loan debt. It is not unusual for a dental student graduating to have $280,000 to $300,000 worth of student loan debt. So upon graduation, they have to go somewhere where they can make enough to start their student loan payment, get a house, get a car, start a family, save for education. Something as simple as loan forgiveness for staying in the state in underserved areas and underserved populations will make a huge difference in whether somebody decides to go to Martinsburg or to Washington, D.C. or to Webster County, for example.
Sure. I'd like to add something else. The other thing is you have, at my heart, I'm a medical educator. That's what I am. I'm a teacher. And what you need to do is instill within your students passion for what you're about. And so at WVSOM, in fact, happening right now on my campus is all the first and second year students are going through Rural Health Day. It's just sort of ironic that we're talking about rural health today. And they are going through a rural health program where alums, graduates of our school who work in rural health are sharing their experiences and sharing why they choose rural. Because the reality is most of our professional people, most of our physicians and dentists get trained in urban areas. You have to inspire them. Now, a lot of them want to go back, people like Dr. Dino Beckett, who always wanted to go back to his home in Williamson and make a difference in his town. But you also can inspire people, and people are ready for it. People are ready for a change and being able to show them a way. So the other thing the legislature does for the schools is our Rural Health Initiative. and providing incentives for students to explore rurality. At WVSOM, we require all of our students to do rural rotations. Plus, they're in rural settings for the most part. So I think all of those types of programs will help support and grow more providers for the state. And then the other thing is what we all got to work on is improving our health. Each one of us has to make a personal commitment to health. We need to influence everybody around us. That, I think it's essential for the state because we have unhealthy communities. And if we want to grow and prosper, we need to be healthy. And we all have a responsibility for that. Certainly the schools do. And certainly some of the things that WVSOM is doing and WVU and Marshall are doing, as well as the hospital systems, is critical, I think, to the future of this state. Because we have some of the worst health outcomes in the country, and those can be reversed if we put effort towards it.
Okay. Now, Admiral, I think the question I'm about to ask is really more your field of expertise, but I think you've answered a little bit of it in the last answer you gave, but if you can expound on it too. You were talking about, you know, the oral health in the state. It has its struggles. The Wild Hub study looked at 26 key indicators. It was, I think, 40th or 49th in the United States, counting the District of Columbia. A story I just read in the West Virginia Watch about the Oral Health Coalition. Oral health has improved slightly in the state of West Virginia. It's gone from a D to a D+. And I'll ask this first to you, but sure, whoever else wants to jump in can. What can be done to kind of start reversing these trends of poor oral health, which I think also, you know, leads itself into poor health in general?
I think I used this term earlier, you know, and it goes back to where people are born, where people are grow, and where the priorities are placed. To make a significant change in oral health and the status of oral health, it's nothing that's going to happen overnight. We need to start with educating our pregnant moms. We need to start with dental visits for, you know, within the first year of life. We need to ingrain prevention into, as Jim touched on there, the ability to educate our families about the importance of good health care, good diets, healthy living. That's where it starts. And we build on that. Once you're taking out teeth or you have advanced tooth decay, you've kind of lost the battle, right? You're in a reactive mode versus a preventive mode. And it is a change of mindset, a change of philosophy, and it's an approach to getting folks educated about all health care, oral health care, general health care, all health care, very early in life, and moving that needle forward there.
Would either of you guys want to add to that, or is there anything you else want to add?
Well, you know, two things that you could do to improve health in this state, including oral health. We need to tax tobacco more. I mean, you know, tobacco is one of our biggest problems, and sugary drinks. Those two things. If we did something about tobacco and sugary drinks in this state, we could start making a change. I don't know how you do that, but certainly I approach it from an education point of view. But smoking and what we're doing in terms of nutrition is what's killing us. It's literally killing us. You know, we did a study, WVSOM did a study years ago. Of course, you know, we're right near the state fairground. We did a survey. We have a booth at the state fair under the grandstand. We used to do this survey where we asked people, well, what are your health conditions? And so they would say, well, I got, you know, do you have high blood pressure? Yeah, I got high blood pressure. I got sugar. I got all these things. And then at the end of the survey, we asked them, well, do you think you're healthy? And it was amazing. The majority of people with all these health problems would say, well, yeah, I'm healthy. People don't understand what health is. I think what it is, hey, I'm here at the state fair. I'm having a great time. I'm eating my donut burger and I feel great, even though I have high blood pressure and sugar problems. That's the problem. It made me question, what is health? I was overweight. I had high blood pressure. I had sugar. Over COVID, I lost 55 pounds. Everything's been reversed. It's possible. You can change your life. We can change the life of people in this state. So food deserts, we got to work on nutrition. We got to work on better oral care because, a lot of times the problems in the body begin in the mouth. So there's a lot of work to be done. And I think there's a lot that we can do at the state level that could really make a difference for our state.
Okay, I want to open it up to any questions here here among the press. Anybody wants to step up? Anybody have any questions? Yes, no? Crickets? All right, I want to keep going. Now, Ms. Pellegrin, I want to go back to something that you had mentioned a little bit earlier about the opioid crisis, about the emergency badges and things like that. For all of you, what has this crisis done to make your jobs harder, and what can the legislature do outside of what it's been trying to do to reverse this so that you guys and the people who you teach, the people who work for you, feel safer and feel more able to do the jobs that they're trying to do?
Well, I can address right up front a couple of ways it's made it harder. For one, it's difficult, and anybody who has a large workforce has this same problem. It's difficult to hire folks who are drug-free. Mm-hmm. So CMC is 8,000 employees, Vandalia Health is 13,000, and it's no surprise to all of you in the room that healthcare are the largest employers in all these communities, right? And so it's been very difficult to hire and maintain staff during the opioid crisis. The other piece I touched on earlier, it has definitely made for a more combative environment, both with patients and families often. And that on top of the COVID crisis has made it a less attractive field for people to be nurses or physicians, or there are a lot of other people who support the healthcare field. You have dietary who interact with patients. So it's become a more difficult environment overall, which I mentioned earlier is requiring more security. But I think it's made it more difficult for folks we had a lot of folks who retired from nursing who said, I might have given another 5 years, but it's just gotten too hard. And I think it's also, we touch on, not to get back into the obesity piece and just your own healthcare piece, but I've had a lot of folks say it's difficult to care for. I wanted to be a nurse, but it's difficult to care for people who don't want to take care of themselves. So there is that personal responsibility piece as well. But on the opioid piece particularly, it has created some of those challenges, both in hiring and just making a more difficult workplace.
Dr. Nemitz, how does that affect you at the educational level, at that almost base level?
Well, the biggest thing is stigma. It's remarkable how people view somebody who has substance use disorder. And so part of what our job has been is to break that stigma down, because it exists within students and it exists within physicians. I tried to get an MAT program started at my school. It took years to make that happen, to break down stigma. And so we need to educate people. We need to educate our students and our physicians that people who have substance use disorder have a real problem that is treatable, and you need to have, again, it comes down to access to care and basically bringing these people in and embracing them with services that are effective. And that'll make a difference. And we need to do this because it's affecting all of our communities in such a negative way. I bet every single person in this room has been touched by something that's happened with the opioid epidemic in this state, or the substance use disorder, whether it's alcohol or whether it's some other thing. We've all been affected by this. So again, for me, it comes down to educating people. It comes down to educating future physicians so that when that patient comes into their office, they can take care of them and help them get better.
I think
how's it affected the dentistry field?
Yeah, I think emotional health, emotional welfare, psychological safety, from both perspectives, from the patient perspective and from the staff perspective. It has drained, the opioid crisis has drained folks emotionally, physically, psychologically, and it makes the practice of healthcare, the delivery of healthcare, and the receipt of healthcare, the recipients of healthcare, much harder.
Now, I wanted to go to another kind of angle here. According to U.S. News and World Report, West Virginia has the 6th highest infant mortality rate in the nation. I mean, that's scary, especially in a place where we need to protect the kids. I mean, we've been hearing all day from so many different people that young people are the future of the state. We need to keep them here, but we also need to keep them healthy. You know, what do you feel that the legislature can do to help you guys turn that number around, or at least start turning that number around?
Well, certainly you got to pay attention to women's health. And then again, it gets back to there needs to be incentives for certain to keep specialists here in the state. I know in my own area there are challenges with having enough OBGYNs in the area. So again, it gets down to access to care, being able to have an OBGYN that's nearby, and then also having the facilities to allow for that delivery, and then having your tertiary care facilities when things go bad. So you need all of those pieces.
I think part of it goes back to what we started with too on the financial stability piece that I'd mentioned, because you do have to have access in your community to good women's care, OBGYN, and then you need the access to tertiary care centers. Obviously between CAMC Women and Children's and WVU Medicine, we both have 30 plus specialists, pediatric specialists, and so we're able to cover the North and the South very proudly. That most of the pediatric patients who need a specialist don't have to travel to Cincinnati or Pittsburgh, but that basic care right up front in women's care is very critical on the infant mortality piece, and keeping that in the community. And in the last 10 to 15 years, when you look at the number of critical access hospitals and other facilities that we're delivering that are no longer delivering, so people are having to travel farther for that care, less likely are they going to travel regularly for prenatal care. So creating that stability around healthcare and those entities that are providing healthcare, that financial stability, is absolutely critical.
And drawing on my experiences in healthcare and the military health system, when it comes to prenatal care, early prenatal care, and then having that right mix of specialists to help the moms through the challenging period, and a lot of that comes back to cost, right? And I don't know if it's still true today, but it used to be some of the highest malpractice insurance centered around obstetrics and gynecology. So and that makes it harder for folks to get in and be able to afford the care, because the providers delivering the care are having to pay exorbitant amounts of malpractice insurance. So it goes back to some of the things we talked about earlier. It's early access to preventive care, to preventive health care, educating the patient, educating the moms, educating the dads, because all too often they may find themselves in a situation where it goes from generation to generation to generation, and how do you break that cycle? And it starts with education.
What is that doing, if anything? What sorts of access?
I don't think we've seen the impact yet, but there's definitely been a chill. you know, and there's concern. There's concern within the medical community. I mean, and you're seeing this played out across the country in states where there have been even more significant bans. Is that you know, one of the most, I'm not a physician. I'm a Ph.D. anatomist. I'm an academic. One of the things about when you're around physicians, their license is something they work incredibly hard for. As we've heard, they go into hundreds of thousands of dollars of debt to get this license. This license becomes one of the most valuable things they have. And maintaining that license is critical to them. And so anything that jeopardizes their license is taken very seriously. And so that's part of the challenge we have in our society right now, is we have different views on the issue of abortion, but it's affecting now the care given to women and unborn babies that is concerning. And I don't know what the answer is. I just know that it is a problem brewing. And I don't know if it's affecting things in West Virginia yet, but certainly OB-GYN care I would think is a concern in the state. And the evidence is the high rate of death. That's what you pay attention to. And we need to continue to pay attention to that.
I think the other concern is in medical education for folks who are going to go into training for OBGYN. There is a concern that they're going to go where they can train for the full prospect of all situations. And so if they're in a state that bans abortion, they may not be able to get the training that they need to provide full services. So I don't know that we've seen that yet, but I know that is a concern for folks who are medical educators.
Amber, do you have any?
No.
Okay. All right. Any other questions?
Yeah, absolutely. I mean, you know, that's part of, I think that's part of the challenge for West Virginia, is because we have an older population, and that population is growing, that we need to, you know, certainly a lot of healthcare is directed to the geriatric population, but there's a need for specializing. You know, one of the challenges with that is getting people interested in geriatric care. I think, you know, WVSOM does a good job of, I mean, we have one of the highest percentage of family medicine physicians in the country. We've done a good job there, but for reasons I don't fully understand, it's harder to get people to go after geriatrics, and I'm not sure why that is. But yeah, there's certainly a need for more geriatric care and helping people as they age, how to age and how to you know, make the adjustments to aging.
All right, and sir, you have a question?
In a word, over time, if the cuts continue to go deeper, devastating. I mean, because we are. In some markets, when we look at Vandalia Health, some are 17 or 16% commercial payers, so not even 20, Diane. I mean, and then there are others that might be 21 or 22%. So that challenge is very difficult. The West Virginia Hospital Association, Jim and his leadership, we do a great job as hospitals coming together to educate the legislators on that, and obviously the federal level as well. But it's difficult for, I think, most states, but it can be devastating for West Virginia where the commercial payer mix is so low.
All right. Any other questions from the audience? Yes, ma'am.
Well, I specifically, I don't have anything specific on emergency care, though I would be an advocate for that. What we have been doing a lot of is community health workers, you know, and educating people on how within the community you can help your neighbor in terms of dealing with health and when they're not healthy, what to do when they're not healthy. But in terms of, I mean, again, what we need in a state as rural as we are, our emergency services are critical. Our community-based services are critical, because those are the resources that people have in the small towns. And so we need to continue to pay attention to those resources and help them as we're able to.
I think emergency medical technicians, paramedics, in the military health system, we had combat medics, we had independent duty corpsmen. I mean, these are the primary care providers, right? I mean, we send submarines to sea that don't have physicians on them. They have well-trained, advanced technicians that provide the care for those in need. So it is, I think it's imperative to get that first responder, that initial engagement, EMTs and paramedics save lives every day.
All right, no, well, I'm going to end with one of my own. So we've been talking a lot about the challenges in West Virginia healthcare today, but I want to end with a question. What do you guys see as some of the breakthroughs and the positive steps in healthcare in West Virginia in your respective fields? Whoever wants to start.
Well, again, you know, I really applaud the efforts that are being made in terms of growing residencies in the state by CAMC Vandalia. The rural surgery residency program at Logan is first one in the country. We need to do more of that. Most residencies are in cities. We need to grow rural residencies. WVU Medicine has started a rural psychiatry residency, desperately needed. We need to do a lot more in terms of mental health, and that's one area we're really suffering on. So I think those areas are real bright spots. I also think that, you know, certainly, you know, I'm committed and my institution is committed to continuing to produce as many physicians in all specialties, but especially physicians who want to practice in rural West Virginia, in the small towns. And I really think there's going to be a resurgence of this as we figure out our broadband problems and get solutions. People are going to want to go back, I think, to small town living. And I really am optimistic about that.
Ms. Pellegrin?
So there are a lot of bright things in the future, I think, and partly around technology that we talked about a little bit. The innovations around medical technology and medical procedures and pharmaceuticals are amazing, and they're happening every day. And being, you know, having the marketing and PR side of it and hearing the stories that are coming in, it used to be you'd have one or two of those a year, and now we have one or two of those a month, where we have stories that we're able to call the press and say, hey, this is what we're doing now. It's really incredible. CMC's involved in more than 300 research protocols, many of those for pharmaceutical. And so many chemotherapies and other therapies around oncology are now done by pill, fewer side effects. That's growing exponentially in that field as well as others. And then some of the, you know, interventional technologies now that are coming out are just unbelievable. People just think 10 years ago how many open heart surgeries we have, and now it's an interventional. And even now we're moving from less of interventional, it's more we're going in and we're doing cardiac imaging and seeing, okay, we don't need to go in and do a stent, we just need to do XYZ. And so the level of care is growing better every day. People are spending fewer days in the hospital, their downtime is less, their PT is less, their costs are less. And so I think those advancements are really, especially I think because of technology and research, just growing exponentially, and that's exciting.
Admiral?
Yep. I think approximately about a third of the state of West Virginia are eligible for Medicaid. And in our profession, you know, pediatrics, we can do a lot with pediatrics if someone's qualified for Medicaid. The adult Medicaid benefit I mentioned earlier, it's $1,000 a year. At our school, $1,000 a year goes a long way in meeting needs, but it's just the tip of the iceberg. There's a lot more need out there. I think the third thing is, and you touched on it, is technology and the impact of technology, the impact of developing technologies cannot be understated. So the infrastructure, the facilities infrastructure, the hardware infrastructure, software infrastructure for leveraging technologies to help us meet these access to care needs across all of healthcare.